Hello. Today we're going to be talking about health insurance. Health insurance is an insurance that covers the whole or part of a person's medical expenses. So, if you need to go to the doctor, health insurance will help cover for that cost. If you are with your significant other and you are having your first child, this can be quite an expensive expense. Health insurance will help cover for the doctor's visits for your child, and they will also help cover the hospital expenses for when your child is born. Now, example of medical expenses that can be covered with health insurance. This could be your regular doctor's visits. It can also include medical expenses such as staying at the hospital or even medical exams including an MRI. And finally, it covers prescription drugs. Now, medical expenses can add up really quickly and they can be very expensive. Health insurance makes these services more affordable and manageable. So before we start talking about healthcare coverage, let's talk about some health insurance vocabulary or some terms that you're going to hear. A deductible. The deductible is the amount of money a person will pay before a health insurance company pays for their portion. So, an example, a person with insurance may have to pay a $500 deductible each year. This means that the customer will have to pay the first $500 of any medical expenses before any costs are paid for by the insurance company. It may take several doctor's visits or prescription refills before your insurance company helps to cover the costs. So, as I gave the example before, if you and your significant other are having your first child, sometimes having a child can cost anywhere between $10,000 and $20,000 just for the hospital visit. With health insurance, the health insurance would pay for those doctor visits and would also help cover the cost of that costly hospital stay. So you would be responsible for paying the first $500 of any expenses that year, and then the health insurance company would help cover the rest. Coinsurance. Coinsurance is the percentage of the total cost that an insured person may also have to pay. So, an example, the coinsurance rate is usually a percentage. For example, if the insurance company pays 80% of the claim, you pay 20%. So, let's say that your medical expenses for a X-ray or MRI were $1,000. The insurance company would be responsible for paying 80% of that claim, or $800. You would be responsible for paying 20%, or $200. Copayment. Copayment is the amount a person must pay out of pocket before the health insurance pays for a particular visit or service. Example, a person might pay a $45 copayment for a doctor's visit or to obtain a prescription. So, for you to go to your doctor and have a regular physical or your annual doctor's visit, you might have to pay $45 for that visit. You pay them $45 and then they will see you, okay? If you go to Walgreens to pick up a prescription, that prescription could be a couple $100, but you are responsible for paying the first $45 of that. Primary care physician. A primary care physician is the medical professional that handles all your basic medical needs. Types of doctors that have been your physician include a family doctor or your pediatrician when you were younger. Example, in order to start high school, you would have had to get a current physical. You most likely would have gone to your doctor's office where your family doctor would have given you your physical. Now, time to compare health insurance. Comparing HMO to PPO plans. These are the two major types of plans that people who have health insurance are offered. Now, not all employers will offer both options. If an employer is only going to offer one option, typically it'll be a PPO plan. But if they offer more options, they will offer the HMO and the PPO plans. HMO, Health Maintenance Organization. For this, a primary care physician is required. Okay, so in order to go to a doctor or have any kind of medical services, you need to have a family physician or a pediatrician. That is required. Also, you need a referral. So, in order to get anything outside of the doctor's office or your pediatrician, you will need a referral to any specific type of specialist. So, if you have a rash on your arm and you think it might be some kind of skin condition, you will first go see your primary care physician, the doctor. They will look at it. They might be able to help you out, prescribe some kind of ointment or medication. If not, they're going to give you a referral to then go to a dermatologist. You will need to go to a provider or specialist or hospital that is in network. So these mean the places that will treat you. Now, with an HMO, you're going to have limited doctors. You're also going to have only certain hospitals that you can go to. And if you have any other type of specialist or other providers, those are also going to be limited. Out of network, this is not covered. So if you decide to go somewhere else to get covered, your health insurance is not going to help you. Okay. If you need to get treatment somewhere else and is not covered with your healthcare plan, your insurance company is not going to help you. The other thing, the overview. This plan is managed to help control costs. Okay. It gives you fewer options, but overall, it is less money for you month to month, and it'll help control the overall amount of expenses that you have with health insurance. PPO, or Preferred Provider Organization. With this, the primary care physician is not required. Most people will have a family physician or pediatrician for their children, but again, it is not required. For you to go get services at a specialist, you do not need a referral. Okay. So, with that situation with the rash on your arm, you would not have to go see your primary care physician and then go see the specialist after getting a referral. You could just make an appointment with a dermatologist's office and then go see them. The in network providers, so this could be specialists, other doctors, hospitals, it is typically a lot larger, so you have more options. Out of network, these options will be covered. Okay, so if you decide, oh, I want to go to this different type of dermatologist versus that one that's in network, you can go there, but they're not going to reimburse or cover the cost as much as they would if it was in network. So, for instance, with that $1,000 expense where the insurance company was going to cover 80% or $800 and you had to pay $200, out of network, they might pay 60%, or they're going to pay $600, and you're responsible for paying $400. Again, you can get treatment, but you're going to have to pay more for it. Overall, this is the less managed healthcare option plan. It is typically offers more options for those who need medical help, but it's also going to cost you more. So, which plan is best? The HMO plan is a more restrictive healthcare plan that is typically the more affordable option. It may be difficult to get approvals for your primary care physician for tests and procedures. Typically, an HMO plan is more affordable, and if you don't use as many medical services, you only go to your doctor once or twice a year, and you don't need to see a specialist, this is typically the plan that most younger 20 and 30-year-old people will go to. Okay, it means they have more money overall for them, and they can still cover stuff that they need when they have health emergencies or need to go to the doctor. If you need more medical help, the PPO plan is probably the better fit. The PPO plan is a less restrictive option. PPO plans typically cost more than the HMO plan. PPO plan also allows the patient to have more control over their providers, so you can go see doctors when you want to and where you want to, and lets patients choose healthcare providers. So you can choose your doctor more easily. You can also choose the specialist you want to go to, and you also have more options with hospitals that will be covered. So this will give you a more better understanding of the two types of medical coverage and which one might be a better fit. Again, when you do get health insurance, you're going to want to look at all the options that are available and which one is best fit for you. Good luck.